Vital signs are often the first thing nurses learn, and unfortunately, the first thing many stop thinking deeply about. Numbers get written down, charts get filled, and it becomes routine. But in real nursing, vital signs are not just numbers. They are early warning signals that something inside the body is changing. Welcome to the Learning Studio, where we don't just teach theory, we show how knowledge turns into real-world understanding. Many students believe vital signs are basic and uncomplicated. Once you memorize the normal ranges, you move on. But experienced nurses know that abnormal vital signs rarely appear suddenly. They drift, they trend, and if those trends are ignored, small changes turn into emergencies. Think of vital signs like the dashboard of a car. A warning light does not mean the engine has already failed. It means something is moving in the wrong direction. Heart rate, blood pressure, respiratory rate, temperature, and oxygen saturation serve the same purpose in the human body. They alert nurses before damage occurs. At the bedside, vital signs guide almost every nursing decision. A rising respiratory rate may appear before oxygen levels drop. A falling blood pressure may signal internal bleeding or sepsis long before the patient looks critically ill. A low-grade fever may be the first sign of infection. Nurses who understand these signals act early, not after the situation becomes critical. Normal ranges are important, but context matters more. A blood pressure that is technically normal can be dangerous for a patient who usually runs higher. A heart rate that seems acceptable on paper may be abnormal for a resting adult. Nursing judgment comes from understanding what is normal for this patient, not just what is written in a textbook. Across hospitals, emergency departments, and community care, vital signs are used to trigger rapid responses, escalate care, and prevent deterioration. Many early warning systems and scoring tools are built entirely on vital sign trends. Nurses are often the first to recognize these changes and initiate life-saving interventions. In practice, nurses do more than record numbers. They look for patterns. They compare current readings with previous values. They ask why a change might be happening. They reassess instead of assuming equipment error. This habit of questioning is what separates task-based nursing from clinical nursing. The NClex places heavy emphasis on vital signs because they reflect real-world priorities. Questions often ask which patient needs attention first or which finding is most concerning. In most cases, the correct answer is linked to an abnormal or changing vital sign that signals immediate risk. Now that you understand how vital signs function as early warning indicators rather than simple measurements, the next step is learning how nurses use assessment frameworks to connect these signs to patient conditions. That deeper assessment process is where clinical judgment becomes decisive, and that's what we'll explore next here at the Learning Studio.